All right, so we are talking about why we want to exercise, uh, and especially for seniors. I think the key piece is that exercise um, helps you stay active. If you ask any senior what's their biggest fear, their biggest fear is they will not remain independent, whether it's
Mhm.
walking, whether it's daily activities of living like dressing or balance or falling. And exercise like chair yoga has huge benefit for keeping them independent. So for me, as a physician, as a geriatric provider, that's critical to keep my seniors independent, whatever the settings are at home, assisted livings, uh, so that they can have a energetic life. And it sounds counterintuitive that you say, I'm going to do exercise or chair yoga, I'll get tired, but no, you get more endorphins and you get more energy, right?
Yes. Hmm.
And the other important piece is not just good for the body, the exercise or chair yoga or any form of exercise for the seniors. The other worry I get from the seniors all the time is uh, is I'm going to become forgetful, or I'm going to get dementia, or I'm going to get Alzheimer's. And there's a lot of good data that if you do exercise in your senior years, you get more circulation to the brain, and it helps you keep your mind strong too. So you get
Hmm.
less chances of getting dementia or Alzheimer's if you do regular exercise. So that's another good reason to, uh, follow what Jordan going to teach you today, the chair yoga. Um, the other piece which patients talk to me about are the fears they have as they get into their older years is falling, and the balance is critical. As we get older, and our nervous system, our musculoskeletal system, our bones, uh, joints, they are kind of tendons, ligaments, they're not as robust anymore. So you got to practice some form of exercise, and the CDC, so the Center for Disease Control, recommend at least 30 minutes 5 times a week or 150 minutes a week exercise to uh, get the good benefits of exercise. And you say, gee, man, 30 minutes is too much if you're not exercise kind and you're sedentary right now. So I tell my patients, you can break it into 2 chunks or 3 chunks for that matter. You can do 10 minutes 3 times a day. You can do 15 minutes twice a day, morning and evening. And what Jordan going to teach you is beautiful. I watched the video. She did a great job, and we'll run in a minute. And you will see the benefits of doing that accumulatively. You didn't get here overnight. You got to practice it on everyday basis to reap the benefits. But if you do them regularly, your balance improves and your falls will go down. So that's other fear patients have, because if you think about it, falls are a big uh, risk for seniors to cause hip fractures and deaths even. So the falls, if we can prevent in seniors with regular exercise, will reduce hospitalization, will reduce the need for inpatient rehab. So just investing every day 30 minutes will prevent you ending up in the hospital or rehab.
I know too, doing exercise, it helps your mood a lot. If you're depressed, if you have anxiety, it really, even just for me, when I work out, it makes me feel good. It helps me start my day off right, and it gives me the energy I need for the day. So it's really like a mood booster.
That's a
And
Go
yeah,
ahead.
so
That's a great point. Mental health aspect of the exercise is critical, and the other aspect, if you do, let's say, something like a class, like chair
hmm.
yoga class or water aerobic class, as Charles is recommending, it gives you a community benefit too. You see your friends, and doing exercise with other folks is much more fun, and then you make a community out of it. And I think that itself helps you prevent dementia. But when you're not just exercising, but you're having fun and you're interacting with other folks, and that keeps you motivated as well. So if you can do with other folks, with a buddy or in a class, I think you get a social benefit along with the good point you made about endorphins helping you with mood, anxiety, depression. Also, sleep. If you think
Mhm.
about it, if you exercise regularly every day, your REM sleep improved quite a bit. And I think I tell all my patients who are concerned about dementia or concerned about cardiovascular disease or other chronic ailments, the three pieces of lifestyle you need to follow. One is exercise, which we're going to elaborate a little bit more with chair yoga. The next is the food. So if you give good offering to your body or good nutrition, that's critical. And the last piece is sleep. So I think they're all tied together. If you exercise, you get better REM sleep. You eat better, that helps you with recover from the exercise and also improves your mood. So if you do those three things, that's what I call three-legged stool, which will keep you strong. I think bone strength is another important piece. As we get older, we get osteopenia and then further osteoporosis. And if you do weight bearing exercise, chair yoga is not weight bearing, but if you walk or even just treadmill or any weight bearing exercise, that will make your bones denser and prevent osteoporotic fractures. So you see people bent over as they get older because there's spontaneous compression fracture in the spine. And if you work on your core, for example, Pilates is another of my favorite. We're not going to cover here today in this program, but uh, the core muscle strengthening is will help you prevent, along with weight bearing exercise and calcium supplementation and nutrition, protein in your diet. Uh, that will help you keep your bones strong and prevent fractures of your hips and your back from reducing falls also. So that's another key. Balance will improve and bone strength will improve. And the other piece I want to bring up here, and a lot of good data on that, is if you do cardiovascular exercise and even chair yoga on regular basis, what you're recruiting is your breathing. We forget anytime we do any exercise, we are using a breath. When you use your breath, that helps you uh, control your autonomic nervous system, which is the nervous system which helps your heart and your lungs. So if you do any kind of exercise on regular basis, whether it's chair yoga or cardiovascular exercise or swimming, as Charles pointed out, or Pilates, or for that matter, biking or whatever makes you happy and you can do it, you will see you will have less blood pressure. Your blood pressure improves if you do regular exercise. So that's another beautiful advantage of doing regular exercise. And the other part attached with the blood pressure is uh, heart health. So if you have congestive heart failure, you have coronary artery disease, you had stents put in, you had a bypass in the past, any of those conditions, COPD, you will see that there will be advantage of exercise on your heart health, your lung health, because you're combining not just exercise, you're also combining breath work with the exercise.